Welcome to the Sarah Finkelstein Show. Today is February 3rd, 2022. A lot of seniors have concerns about costs in retirement. For example, health care costs in retirement. This is an important topic that we're going to delve into tonight. So seniors are concerned about what they can expect to spend for health care during their retirement years. The truth of the matter is that costs continue to outpace the rate of inflation. This represents a big expense for retirees. People are living longer than ever before. And the longer that we live, the more healthcare costs we are going to encounter, right? Did you know that today there's a 1 in 4 chance that one member out of a couple will make it to age 97? Now, in our family, we have certainly experienced this. My husband's grandparents, grandpa lived to age 90. Grandma is currently 99 years old. She just turned 99 in December. Her sister lived to be 106. So yes, it is so true that people are living longer than ever before. And that requires careful, calculated planning. If you retire at age 62, and average life expectancy is 84, that means that you will spend 22 years in retirement. But that's the average. Now, we know what happens with averages, right? Some people live beyond the average. So it's important to know that life expectancy is increasing for many individuals. A lot of people today that are well into their 80s and 90s never thought that they would live so long. So the probability of needing extended care during your retirement is a huge number. 70% of people over the age of 65 will, I repeat, will need extended health care, such as long-term care. And 40% of those people will end up in a nursing home. So think about it, 70%. That's 7 out of 10 people. That is a huge number. There are about 78 million baby boomers, and 70% of that figure is over 50 million. So the risk of needing long-term care is very high. It is high enough that it should not be ignored. We should not put our heads in the sand and think that it won't happen to us. Yes, 7 out of 10, that means that 3 out of 10 are never going to need long-term care. There are different studies out there that reference what is the dollar figure that couples should allocate for their health care in retirement. You'll find different studies, but this particular study, done a couple of years ago, said that a couple retiring at the age of 65 will need 300,000 to 95, close enough, 300,000 in retirement. And that does not even include long-term care. It does not include extended health care in retirement. If we add the cost of long-term care on top of that, we are talking huge numbers that could really hurt you and your family if you don't have a plan in place. So what does it cost for extended health care? If you need an aide to come into your home, a home health aide, to come and help you prepare breakfast for you, help you to take a shower, help you to get dressed, maybe take you to your doctor's appointments or take you out to lunch. What does that cost? A few years ago, this particular study said that that would cost roughly $50,000. But that's not the only place that long-term care occurs, right? You can get long-term care at home, but a lot of people decide to go into assisted living, which is having your own apartment. And the cost of that is just under $50,000. Now, I could tell you that what my family had experienced with assisted living was more than that. When grandma and grandpa were living in assisted living, it was about $6,000 a month. That's roughly $72,000 a year. But these numbers are averages. This report was done back in 2018 by Genworth, which is a company that used to sell long-term care insurance. And a nursing home happens to be the most expensive on this slide. Nursing home is $90,000. Now remember, it all depends on where you live in the country. It varies. But these are some basic numbers that you should consider. Now, the average long-term care claim for males is 3 years, and for females is 4.2 years. So you do the math on that, and it could bankrupt your retirement nest egg. And it doesn't have to happen to you if you plan appropriately. So let's see what these numbers are projected to be in the future. So a home health aide in 2038, less than 20 years from now, is going to run over $90,000. And assisted living is going to run almost $87,000. And look at nursing home, $161,000 a year. Now, my mother-in-law passed away a couple of years ago, and she wanted to be in a specific nursing home. The cost there was $13,000 a month. Imagine that, $13,000 a month. That is huge. So how do you pay for long-term care? Well, you can pay out of your own pocket, out of your savings. Maybe you have a rich relative that's going to pay the bill for you. Or is it going to come out of your portfolio or your retirement nest egg? One way or another, it needs to get paid for if you are that 7 out of 10 that will need long-term care. Now, of course, there are government programs, and we will talk about that. Another thing that you can do to protect yourself and your family is you can purchase a long-term care insurance policy. You can pass along a portion of that risk, or you can pass along all of the risk to an insurance company. And that will save you money in the long term if you need to use your policy. So let's talk about the government programs. Now, Medicare does cover some home health care, but it has to be skilled care. You have to have spent at least 3 nights in a hospital, and it will pay for 100 days in skilled nursing facility. After that 100 days is over, then you're on your own. It does pay for the skilled care, which would be a physical therapist, a speech therapist, or an occupational therapist. But Medicare does not pay for custodial care. That would be what the aide would be doing, which I spoke about in the previous example. An aide that comes into your home to help you with bathing and dressing and take you to your doctor's appointment. That is custodial care. Medicare does not pay for that. Now, what about Medicaid? So for Medicaid, you have to qualify based on your income and based on your assets. And most of the time, it's skilled nursing facilities. So Medicaid will pay for skilled nursing facility in full. And in terms of assisted living, there is something called a Medicaid waiver, which pays a portion of the assisted living. It does not pay the whole thing. I would say it probably pays about maybe 25%. You still have to come up with 75% of that monthly cost for the assisted living. And there's also a spend down. There's a 5-year look back when you do Medicaid, when you go on Medicaid. So long-term care insurance pays what your needs are, whether you want to have your care at home, which, by the way, most people do want to stay at home as long as possible, but it'll pay in any scenario, whether it's at home, whether it's assisted living, or whether it's in a nursing home. And it's really up to you where you get your care. You can select any of the assisted living communities that are a good fit for you. You can select any home health agency. You're in the driver's seat. You decide. And it makes things a lot smoother for your family because long-term care, I've said this before, is a family affair. Think about it. If you needed help, who would you call? You'd probably call your son or your daughter. You'd call a relative. That would probably be your first call. And together as a family, you'd come up with a plan of how to get the care that you need. So as we said before, long-term care costs increase higher than the rate of inflation. And when we use the rule of 72 to figure out how long before we need twice as much money to cover that cost, well, if inflation is 3%, that means in 24 years, we will need twice as much money to pay for that care. If inflation is 5%, it'll be 14 years before we need twice as much money to pay for it. And if inflation was 7%, these are just some examples, then in 10 years, the cost of long-term care will double. So we need to plan and plan appropriately. So this is a picture of myself, and that's Grandma. As I said, she is 99 years old, and she is another one of those people that would say, I never thought I would live so long. Well, we don't know how long we will live, but we do know that on average, people are living longer than ever before. So I always like to talk about planning. It's all about planning. Benjamin Franklin said, if you don't plan, then you're failing to plan. So it's important to plan, have a plan in place. It should be a written plan. And remember, the decisions you make today affect your tomorrows. So thank you for joining me tonight for the Sarah Finkelstein Show. And I look forward to seeing you tomorrow. And if you have any questions, feel free to reach out.